Hello, and thank you for joining us for this edition of 12 Health. As we know, October is Breast Cancer Awareness Month, so we are once again talking about breast cancer. And to join me today, I have Dr. Sophia Risk, an oncologist with South Coast Health, and Christine Alex, currently undergoing treatment, a breast cancer survivor, both joining us. And Dr. Risk is Christine's doctor. So they're going to give us a little bit of what Christine is going through, and we're going to talk about some of the developments in breast cancer treatment, stats as it stands right now, and where we stand when it comes to breast cancer. Thank you, both of you, for being with us today.
Thank you.
So, Christine, you were diagnosed at 39 with breast cancer, which is still rare to be diagnosed so young, but you started getting mammograms really early because of a family risk?
Correct.
So tell me a little bit about that.
Sure. So I was actually recommended by my OBGYN at just a regular annual visit. We were talking about my family history, and there's a distant risk on one of my parents' side. So we discussed maybe just getting a baseline mammogram. And, even though it was early, she felt like it would be something that would be worthwhile to have done. And thankfully, she recommended that because at that point, right off the bat, they started noticing just some minor things that they wanted to follow a little more closely. And because of that early read, when things did start changing, I was able to they were able to notice them right away.
Wow. What was that distant risk? Because I think a lot of women are like, well, what is a risk? Like someone on, a cousin of a cousin of a cousin had, what is it?
Sure. So in my case, it was a risk on my mom's side. All of her siblings, thankfully, and her mother did not have breast cancer, but all of her aunts on a parent's side, so my great aunts, all of the females had breast cancer. So it wasn't so much a close risk for me, but more of just the volume of people that had it. That my doctor, like I said, just felt like getting that initial read would be important in the event that things changed down the road. So, and they did.
And it's really good to know that. I wonder how many people have that kind of family history, because your mom, some of your close relatives, but to know that every single aunt had it, that's important information.
Right.
Dr. Risk, how many women do you see come in and they don't know that family history?
Quite a few. I think one of the things that's always challenging is cancer has been something people don't always want to talk about, and especially in generations in the past, A lot of times people will say, oh, I know my grandmother or her sisters had something, but they never spoke about what it was. So sometimes that piece of family history really is missing.
So what would you suggest to women out there? Should they start digging, especially if they're early 30s?
More information is better. So yes, ask those questions. Ask what information we know. Sometimes we can try to infer from information what was going on, but I think having that open communication is really, really helpful.
Absolutely. Just some stats that we have here. As far as we've come with breast cancer research, and I know I do a lot of events where we do walks, and it's great to see a sea of survivors. I feel like that group of survivors is bigger and bigger every year. But breast cancer is still the second leading cause of cancer death among women. About 42,000 women and 500 men, and we're going to get into that later, die from it each year. And then Black women are 40% more likely to die from breast cancer. So we obviously have a lot of work to do. Christine, tell us a little bit about what it was like kind of hearing that very first, like we already see something, and the evolution and treatment. What's it been like to go through all of that?
Sure. I guess one of the sort of benefits to being screened so early and going to the same center every 6 months or every 12 months was that I really got to know the providers there. And even from the first visit, I went to the South Coast Breast Center in Fall River, and they were just so welcoming and calming. And they came out and just said, the radiologist, wants to get a couple more pictures. They might see something. And I remember the technician explaining in just really simple terms, like, this is what we're seeing. And this is why we aren't concerned right now, but this is why if these things change in the future, we might want to pay closer attention. And so I didn't feel at that point, any real sense of concern other than, okay, let's just keep an eye on this. And that's how it went for, like I said, 6 months and 12 months. And it was last January, I was going for my regular mammogram, and they were comparing them to the previous year. And she said, the radiologist really wants to see a couple more pictures and then a couple more pictures. And let's see if we can get this one a little closer. And every time I went back to do another scan, I'm like, okay, this is a little more, detailed. But again, their approach is always so conversational and so, reassuring that even when they came out and said, we see something that we want to look into more, I knew that the next steps were going to be just as kind of supportive. So unfortunately, I did go for some biopsies. I was connected right away with my breast surgeon in the event that I would need further surgery. So it wasn't a mystery about who I was going to be contacted with for a provider. They really make all the connections up front in the event that you need to go further down the road. So it was really comfortable. I didn't feel, sort of like I was dealing with strangers at that point. And when I did get the call, saying, okay, we've looked at the pathology and you do have cancer, it was coming from a nurse navigator that I'd already connected with, so many times. So it again felt like as much as it was a difficult situation, I wasn't going through it by myself.
You almost were already mentally and emotionally prepared, not just because of your family history and already hearing at a young age, like, listen, you are at high risk, but also because of the people that were surrounding you and had already made you feel so comfortable.
Right.
That's huge. I think a lot of women, even that first mammogram is probably very overwhelming, right, Dr. Risk?
Absolutely. This is very, it can be really scary, right? You're going in for testing you've never had before. You know what we're looking for. We're looking for a cancer. That word can sometimes be really scary to think about. But I'm very glad to hear that we try very hard. And I will say that is true of all breast care centers. We try really hard to make women comfortable, men too, as you said.
Yeah.
But that's one of our goals because it is overwhelming and it is scary to go through this.
All right, I want to get a little bit into your actual treatment, Christine. We're going to take a quick break and we'll be right back. Welcome back to this edition of 12 Health. It is Breast Cancer Awareness Month, and joining me today, we have Dr. Sophia Risk, an oncologist with South Coast Health, and her patient, a breast cancer survivor, Christine Alex of Bristol. Thank you both for being with us again. So you get that, news that it is in fact breast cancer. And these days, Dr. Risk, there's a big, the big part about treating cancer, I think all cancers, is treating them specifically because they have very targeted treatments now, correct? So biopsies
Absolutely.
are really important, things like that.
Absolutely. You get a lot of information from breast biopsies. You get a sense of what type of breast cancer this is, what it's sensitive to, what medications are helpful in treating it. So that's critical.
Okay. Now, Christine is a mom of 3. So when you got that news that, yes, it is indeed breast cancer, the cancer board overlooks what your treatment should be, but you were already leaning towards the most drastic thing you can do, which is a double mastectomy, and that is indeed what you decided to do.
Yes.
How difficult was that decision, or was it, this is what I'm going to do because I don't want to take the risk?
For me, it was an easy decision to make, and I don't mean it lightly. Certainly there was a lot of kind of thought that went into it, but when I really sat down and looked at my type of cancer, what we knew from the biopsies that I had done, there was a lot of risk in not going for that more drastic option. And I, knowing that I have young kids, I wanted to elect the option that would get me kind of back on my feet, hopefully without needing to do a prolonged treatment, without a lot of kind of uncomfortable side effects if I could avoid them. And I was fortunate that the team and the board that reviewed my case, supported that as well. So that was the decision that we came to. And for me, it was the right decision.
Was there an emotional aspect with it too, though? Did you wake up from surgery thinking, I don't feel like the same person anymore? I mean, how emotional and mental is all of that in going through such a drastic procedure?
That's a huge part of, for me, was making that decision. I think I grappled with that a lot more before even approaching the OR. I had to kind of come to terms with the fact that, I have 3 kids, I breastfed my kids, this is a part of who I am. But I also know that I'm more than just that. And I didn't want that to define me. I mentioned to people, like, cancer is not my whole story. It's a chapter in my story. And I wanted to be able to get this chapter kind of over with, to put it sort of lightly, but I wanted to be able to focus on living, not just living with parts of me. So it was really difficult. I have a really supportive husband and family. And certainly the team at South Coast, everyone from the surgeons to social workers that I spoke with, were able to kind of help me through that decision-making process. But going into the surgery that day, I was confident that I was making the right choice for me.
How did you feel afterwards and in the weeks and months following?
Emotionally, it was tough. My youngest is only 3, so kind of explaining to him, mommy can't pick you up, you can't, hug me, you have to be really careful. That was a more of an emotional piece than I was ready for. But finally having the surgery done was a huge milestone for me. Like, I felt like I'm not, the cancer is not holding me back right now. I can start to move forward with my life and with my treatment.
Yeah. And Dr. Riss, there are so many reconstructive options now too for women, that decision doesn't have to be choosing between keeping your body or keeping your life, right?
Absolutely. I think one of the things that's really important is this is sometimes a very personal decision. There are situations where we say, absolutely, we recommend mastectomy or bilateral mastectomy. But then there are situations where we say, not necessarily, maybe a lumpectomy is the right thing, but your personal kind of feelings about it are taken into account too, because some women, just like you were saying, felt that was the right decision. So that is a big piece of it as well.
Okay. I want to go back to the mammogram talk too, because I think more recently we've really started to talk about getting mammograms younger. 40 has been the recommendation for quite a while. But what has changed as far as what doctors recommend now? And if it's every year, every other year, that kind of thing?
So I think things change as we learn more and as we see what trends are happening in healthcare and with breast cancer diagnosis. Right now, we recommend starting at age 40 with annual mammograms. Some professional societies recommend every 2 years. And so that is one thing that you should discuss with your primary care or your OBGYN, whoever is helping kind of make these decisions. But 40 is typically the standard age. Now, as we're talking about, this is not always right for everyone. So particularly if you have a family history, particularly if you have risk factors for breast cancer that exist, that is another situation where you have to talk with your primary care, and you may be someone that gets breast imaging, screening imaging at an earlier age.
I know we said family history. I think exposure to chest radiation is another. Can you talk about what that could be? What is that?
Yes. So if you have a history of exposure to chest radiation before the age of 30, so traditionally that is a therapeutic chest radiation, childhood cancers, things like that,
Okay.
or treatments for Hodgkin's lymphoma in the past have had chest radiation as part of the treatment, that's an indication for early breast cancer screening.
Gotcha. Also, I know I mentioned it kind of earlier, but men being screened to have a high-risk gene.
Yes.
How do men even go through the process of knowing whether they have that gene? This isn't something that we talk about a lot, is men and them getting diagnosed with breast cancer.
Absolutely. Male breast cancer is rare, but it is not never. It is very high. So a man with breast cancer is very highly associated with the likelihood of having an inherited gene, something like the BRCA gene just being one of the genes that we probably are most familiar with at this point.
Yeah.
So male breast cancer is very closely associated with that. And so family members sometimes are tested, particularly if a patient tests positive.
Gotcha. So we are seeing rising rates in women under 50 right now, but overall death rates are declining. Do we attribute that to women like Christine getting screened younger, and that's why rates are going up, and that's why deaths are going down because we're catching it early? Or is there something else happening here?
I think we are catching things very early. I think the one thing that's wonderful is our breast imaging technology has improved over time. And so we are catching breast cancers earlier and earlier, smaller and smaller, which is what we want. That's the point, right? So I do think that probably is playing a role in the rising incidence. But we're at the same time, because of that, we're seeing survivorship of breast cancer go up as well. So it's that's, I think, a reflection of earlier screening, earlier diagnosis, and better treatments as well. Treatments have really improved and continue to improve, every year.
A lot of times we talk only in rates of either survival or deaths. How often are we seeing breast cancer come back in women? Or are we getting better at making sure that we eradicate it immediately?
It's a very good question, and I think a lot of that depends on the type of breast cancer. The risk varies kind of based on different hormonal presentations of breast cancer. You might hear of triple negative breast cancer versus hormone receptor positive breast cancer, and they each have a different risk of recurrence. Where we have, I think, had the most headway in reducing risk is in some of these more aggressive breast cancers. I'll use triple negative breast cancer as one example. Many times now we use what we call neoadjuvant treatment. We give medications, chemotherapies up front to treat that, and that is what we're seeing is that is improving survival and decreasing rates of recurrence.
Wow. Okay, I want to talk much more on all of this. We're going to take a quick break and be right back. Welcome back to our latest edition of 12 Health, where we are talking about Breast Cancer Awareness Month. Before we took our break, we were talking about developments in treatment, but there is the reality that Black women are still 40% more likely to die from breast cancer. What are we doing as far as changing that, and why is that the case?
We need to do a lot better to change it. That's not an acceptable statistic, right? That is not something that we want to see. And I think that there is still really good research going into, well, what is it? Is it that there is, a different type of relationship sometimes with physicians and patients? We want people to have trust in the medical system and have trust in the care that they're getting. Is it that availability of screening may not be as widespread as we want it? There's a lot of different things that could go into that. But that is something that is really an unacceptable disparity and something we really want to work towards correcting.
Gotcha. Let's talk about new mammography technology. I know I heard this last year, but I think it's evolved even further since for dense breast tissue, because a lot of women either have false positives. Mammograms in the past had a really hard time detecting breast cancer in dense breast tissue. I think I've even heard of AI being used now. What are some of the developments in really helping in detection for those women?
So dense breast tissue is, it's something you're born with. Yeah. And so every mammogram now gives an assessment of the density of breast tissue. And that does help radiologists and physicians kind of think about what we're looking at and if there's any additional imaging that needs to be done. Updated, the most recent breast imaging technology is very good. And, as time has gone by, we're getting better and better pictures of even dense breast tissue. There is a role sometimes for things like MRI. MRI imaging can sometimes be used to get even better and closer looks at breast tissue and can be helpful with dense breasts.
And we've made strides legally, too, to put laws on the books to make sure that not just that first mammogram is covered, but those follow-ups if you need the MRI, if you need a second mammogram or imaging, which is huge. Speaking of laws, New York just became the first state to mandate cold caps for hair preservation be covered by insurance starting in January 2026. How huge is that when we talk about supportive care in cancer? And I know, Christine, you touched on this about how important it was for everybody within South Coast who really was there for you and talked to you and brought you through the process. We talk about losing breasts in a double mastectomy, but losing hair is another one that probably for a lot of women feels like you're losing part of being a woman. You're just being reduced to a patient.
Yeah, it's a visible thing, right? And I think that's the number one thing women tell me, particularly, and this is a situation where you're going through chemotherapy for breast cancer, say, your hair, everyone sees it's a visible thing that you're going through some type of treatment, and not everybody wants to maybe have that known at all times. Cold caps are wonderful. We have really good data that they help to reduce hair loss during chemotherapy, and they're exactly what it sounds like. It's a cap you wear on your head. It is cold. It causes vasoconstriction of the scalp, and so less of the chemo gets to the hair follicles. I think it's wonderful that there is this push now to have this technology covered for women because it is really an improvement in quality of life.
What's that like to hear that? I don't think you had to go through the hair loss portion because of the double mastectomy, but I think once you join the world of breast cancer survivors, you know a lot of women who have been through that, Christine. What's that like to hear that at least one state has done something to mandate that be covered by insurance?
I think it's fantastic. Going through it, I think you don't know what you don't know until you're part of this group that you never want to be a part of.
Right.
But that's exactly right. You meet people, you hear stories. I've been in contact with groups that fundraise for tattooing for women who have had to lose their nipples as part of their reconstruction. So the medical tattooing is another piece that I think is really kind of, it makes it improves your quality of life.
Yeah.
So hearing about, these steps to really improve that piece of things, it maybe is not what you would consider typical part of treatment, but it really is. You're treating the whole person. You're not just treating the cancer. And I think that's really critical. And so hearing that there are steps, and there are states that are moving forward toward that can only be improved upon.
So where do we stand as far as your treatment goes, Christine? What's the next step?
So the next step is next month. I have my second and hopefully last surgery for a while, my second stage of my reconstruction surgery. And then if all goes well, I will be done with that phase of treatment. I am on medication for the next 5 years, like Dr. Risk mentioned, that will reduce my risk of reoccurrence.
Is that immunotherapy, Dr. Risk?
No, actually, that is, if I can share, that is hormonal therapy for the most common type of breast cancer we see, which is estrogen receptor positive breast cancer.
Christine has hormone receptive positive cancer. I know we didn't get into that earlier, but just as far as it goes when we're talking about treatment, I think that's an important thing to note. So you were saying that that's a hormonal treatment for her?
Yep. Okay. And that's what we really consider standard of care and has really good benefit to reducing recurrence risks.
And as far as side effects go?
I was so worried about that, and Dr. Risk can definitely attest to that. We had multiple conversations about whether or not I'd be able to take it. Would it bother me? Would would that be another piece of this kind of battle? And I know for some women that side effects are considerable. I've been lucky that I have not had many negative side effects. So for me, the benefit definitely was worth it.
What's it like to spend Breast Cancer Awareness Month as now being a survivor?
It's a different view on things. Like I said, I try not to see it as, the whole of who I am, but it definitely obviously plays a part. I'm so lucky that I have such a supportive network, and my friends and family, even prior to my surgery, kind of rallied around me and hosted a party for me. So kind of in going forward with that, it's just, advocating and making those connections for people. When I was going through my surgery, there were so many people that I didn't know that had gone through similar procedures or surgeries, or had a friend or a sister, and were just reaching out to me and saying, I know what it's like. So that's kind of been my goal, is to just make those connections with people and say, if you don't know anybody, you know one. And I think that's really what I feel like is important to do now that I'm on the other side.
Any message for the women out there before we go?
Talk to your doctor, talk to your provider. If you have questions, ask. There's never a silly question, and just get your mammogram.
Dr. Risk?
I echo that. Talk to your doctor. That is what we are here for. We want to help. And if you are in the position that you are diagnosed with breast cancer, you're not alone. Not at all.
Well, I want to thank you both for being with us for this Breast Cancer Awareness Month 12 Health, and thank you for watching.